Welcome back to the Change Physician Podcast. I'm your host, Dr. Melissa Cady, joined by my co-host, Dr. Kevin Cuccaro. And our guest today, Dr. Alinda Cox, who is from Austin, Texas, my own city as well, is here to join us. Thank you for joining us.
Oh, that's fantastic. I'm happy to be here.
I'm really looking forward to how this shift and things that you've been doing now, but can you start from the beginning and go with like the start of why you went into medical school or thinking about being a physician?
Sure, absolutely. Of course, I grew up in Chicago, and I really, it seems like there's not a time that I didn't really know I wanted to be a physician. Matter of fact, I used to take pocket knives to kindergarten and cut up flies and all that kind of stuff. Got in a lot of trouble for it, but I always thought I wanted to do something, knew I wanted to do something in the health field, and so I pursued it. And I trained in Chicago at Northwestern University Medical School, and went to the University of Louisville in Kentucky for my residency in obstetrics and gynecology. And so it was a great field for me because there's not really any other medical specialty that takes care of two people at one time. And I thought that was really intriguing. And I also love the fact that it was a great variety. So not only did you do obstetrics, but you also did gynecology, which is an office practice. You did surgery. And so it was just a mix of both worlds for me, and was really exciting for me to go into that specialty. And so came down to Austin, Texas for a real job and after my residency, and I've been with the Austin Regional Clinic about 32 years now, and I've since dropped my OB practice. I think it's been about 4 or 5 years, and now I just do the gynecology, the office practice, and the surgical part of the practice. So that's kind of my story in getting down here to Texas.
Yeah, so I'm curious, what were your expectations of how medicine is going to be, or how we take care of the patients and what we can provide them? Like, what was your, if you can think back that far, what was your impression?
I really, when I was younger and less experienced, I really felt like, the sky's the limit, that patients got what they needed, that the healthcare was going to be a option for them. There was not such a thing as, oh, I can't get this, or I can't get that, or the insurance won't cover this, or insurance won't cover that. And so I had kind of this Cinderella world of everything was going to go just perfect and just right. And certainly, as you know, in healthcare now, that's not the case. And we see disparities in healthcare everywhere. And so that I think, it didn't depress me or I wasn't disillusioned so much as that I just realized this was the real world. And residency was kind of a fictitious area, and you trained, but it was not like the real world. And so that's what I found. That's what I found when I got in practice, that things were just not peachy keen everywhere.
Yeah.
So kind of going back there then, for your early practice, you're coming out of residency, and again, it's a bubble world. Residencies are a bubble world, but you're going into early practice. And did you notice, like, from the get-go, were you like, hey, something's different here in how clinical practice is, or did that evolve because you got a breadth of a depth and breadth of experience going back 32 years?
Yes, it really evolved. It seemed to really evolve for me. Now, when I got into practice, I went into practice with the Austin Regional Clinic, so it's a physician-managed, physician-owned group. And so I think for some of these things, I was sheltered a little bit because I was not hospital-owned. I wasn't in a private practice where I had to, to buffet all the different changes in healthcare with insurances and things like that. But eventually I realized, even in the Austin Regional Clinic, we have kind of a governing body that changes in healthcare did affect us in very specific ways. And more importantly, it affected our patients in very specific ways. And so that evolved over time as I became more mature, I think, in the practice and realized these changes that were happening in the healthcare system.
So as that evolved, then did you ever reach a crux when you're like, something has to change here? Like, I mean, we often find that with, physicians get to a point, and it's the breaking or bending point where something has to change.
Yes, absolutely. And what I began to see was that I was responding consistently over and over again to disease processes. I was not helping that patient, number one, protect themselves against these problems. I was on the other end, always reacting to what had happened to them. Reacting maybe to their poor healthcare, or reacting to their poor choices in food and nutrition and things of that nature. And so I began to realize that many of the problems, actually many of the major problems in my specialty, were because of poor health choices that patients made, particularly those that were overweight and really clinically obese. I found that these people had a great deal of problems that I was seeing in the practice, and I'm handing out pills, handing out shots, handing out these different things, and not really getting to the crux of the problem, which is getting them back into a healthy place in their lives in terms of their physical health.
So I'm wondering, how did you respond? Obviously, there was some disparities just in education, and I mean, there's so many disparities, but that in and of itself was a big issue there. How did you respond to that to shift what you were providing for patients?
Well, when I realized that, now that's to say that the Austin Regional Clinic does have a wellness program, but what I found from many patients is that they had to go in, they had to, have consultations, they had to be weighed in. It's a once a week kind of thing, and where they're going in. And so for some patients, it was a little bit onerous. Others did well in it, but many did not. And not to poo-poo their system at all, but and I think it's great that they had an avenue for someone to be able to get back to a healthy weight and to their wellness. But what I found is that people were, hitting and missing on this kind of thing just because of their lives. They're just too busy to be able to do that once a week, to go in somewhere. And so what I realized, actually, I was actually on a mission trip with one of my mentors. His name is Dr. Joseph Pecoraro, and he's a vascular surgeon in Florida, and he founded a mission organization called Hearts of Fire. And so we were on a mission trip, and Joe used to be over 300 pounds. And one day he got off the plane, and I looked at him and I thought, oh my God, you have lost a whole person. And he began to tell me about a health program, a wellness program, and he had lost weight, kept it off now for 14 years. And it was really an excellent program, because not only did it address the weight problem by helping people with their portions and things of that nature, but it also, which is most important, changed the mindset, so that you began to understand. The program teaches about micronutrients and macronutrients, when to eat and how to eat, and portions, and how stress and sleep and interact and affect your health. And so we started to work on the front end of this. And instead of adding another pill, adding phentermine or something to help people lose weight, we began in this program to teach people, first of all, how to help them drop their weight, but also now how to change their mindset and their behavior so that they never have to deal with that problem again. And to learn how to manage and control their weight. So it was really cool. He worked with the program for over 14 years now. And I just got on and I said, this is really cool. This is really a comprehensive program to help people really change their lifestyles and help them prevent some of the problems that I'm seeing in the office. You know, in my profession, there are three major cancer groups: breast cancer, ovarian cancer, and uterine cancer. And I looked up, just kind of in preparing for this talk, this podcast, I looked up just some of the figures from the CDC, and all three of them are related to obesity, all three. And I've seen a young woman in my office as young as 27 years old who was obese and had endometrial cancer. And so it's out there. And this problem in our country is an epidemic. 34% of Americans are overweight, actually are obese. And so, and I looked that up, and it was like 78 million people in America have this problem with obesity, and it causes so many problems, not just in my field, but in hypertension and diabetes and endocrine problems. And so I think it's a number one area where we really need to focus our efforts in helping people get back to normal weight.
So go ahead, Kevin.
I would like to delve into that a little bit more, because you touched on a couple things. Is with your group, they had their regular program, and what I've often seen with the kind of the core programs that are thrown out there is, you know, they think information is going to change behavior, and it becomes this: we're going to do 6 weeks, and we're going to sit in the classroom, and you're going to learn this, and this, and this, and this. Yeah. And then lo and behold, a couple people respond, and then a whole lot of people don't. Yes. And what I find you're really talking about here, and I love that what you mentioned was mindset, and this where you're facilitating a transformation, and that's a very different process.
Yes.
For people to go through. And I think from a physician's standpoint, it's not something that we've learned in medical school.
Exactly.
So where did you learn this, or how did you kind of experience that, or what were your experiences while going through that process yourself?
Well, yeah, I just mentioned this mentor, or actually the founder of this mission organization. I've been going with them for years, like 8 years or 9 years. And so when I saw him and I said, "What have you done?" And then he began to tell me about the program, and there's an educational component to it. There's a community of people that are supporting people that are endeavoring to lose weight. So there's a coach, kind of a health coach. That's kind of what I became, is a certified health coach, to really help people. Anybody that is supported will 90% of the time achieve their goal. And so and that's how I learned. As I kind of walked with him, he actually kind of became my coach, so to speak. And I lost 20 pounds, found that my knees felt better. I do ballroom dancing now, and I feel great, and have for myself been able to keep the weight off for 4 years. And so I found that personally it worked for me, and certainly for him it worked. And people just respond. It's that mindset change that we have to have. Otherwise, people will go back to the same. They'll lose weight, and then they'll go back to the same pattern of eating or overindulging if they don't change their mindset. If they don't change their focus and understand that you're about fueling your body instead of just fattening it up, you know. And so and that's where I learned it. That's where I learned how important that was, and how many different factors are so important in how we manage our weight. Stress, particularly sleeping. People that get less than 6 to 8 hours of sleep a night really have a tendency to overeat the next day. And so sleep is so important. Stress is so important to manage. And so we teach those kinds of what we call habits of health to those that are in our program.
So I'm curious, how do you integrate that You obviously, I'm assuming the OB you don't do, maybe it's a little less call or, or
I don't, I'm done with that altogether.
So how does your week look like? How do you integrate this health coaching into the gynecological type practice, or is it kind of separate or integrated?
For me, it's separate. I certainly don't want to compete in terms of my group. Particularly, they have a program that works for some people, and so the people that I see are generally people that interact with me on Facebook, or people that I know, family, friends, and people as far as New Mexico and Oregon, and people see just people transforming their lives, and they're like, hey, I want that for my life.
So did you find then that you were scaling back your clinical practice in order to open up this other side, or are you doing both?
No, right now, I am doing it in addition to. Mm-hmm. But the person I mentioned, Joe Pecoraro, actually 8 years ago, was able to close down his vascular surgery practice, and he just loved helping people get healthier, and was able at that point, after 8 years of being in the business, was able to shut down his regular practice and start doing this wellness program just solely full time.
So this, as we talked about, this is a different type of skill set, this kind of facilitation rather than poking and drugging, Yes. But it's a learnable skill set. And so what I'd be kind of interested in hearing, because it's not a skill set, again, a lot of physicians have,
right?
But it's a physician that all physicians could have.
Absolutely.
So what have you found as a physician? What are the strengths of a physician to being able to learn and apply this coaching model and style?
Well, I think number one, first of all, your patients love you. And they intuitively believe, and of course should believe, that you are speaking into their lives what's going to help them. And so I think number one, physicians really ought to know, and I think truly should have a sense that your patients hang on every word that you say, and they truly believe that what you say is going to make them better. And so you don't tend to have to worry about trustworthiness, I guess, so to speak. And so it's very easy then to, and you have your hands on the patient. You're interacting with them. They've seen you more than one time. You're hearing about their lives. You're talking to them about their blood pressure. You're talking to them about, in my case, abnormal bleeding or some kind of problem. And so it's very easy to strike up a conversation, and say, hey, it looks like I'm going to have to maybe, add some blood pressure medicine, but I think that if we can get you to lose some weight, that we may be able to avoid that. I can't tell you how many people I've seen in my office that have 2, 3 blood pressure medicines, pumps and pills for their diabetes. And I'll ask them, I said, well, what are you doing to lose weight? Oh, I know. I try to do this. I try to watch my portions, and they don't have a structured way to do it. And when you have a structured way and someone that's helping you and encouraging you, hey, you can do this. People will get on board. They don't want to be 350 pounds. They don't want to be that way. They don't want to be sick. They don't want to have hypertension or diabetes, but they need a very specific way and a very structured way to be able to walk through that every day and know that what they're doing is reproducible, and what they're doing is going to get them the success that they want. And so I think for all of our physician offices, I can't tell you, if I see 32 people a day, I promise you, 20 will at least be overweight, and probably 10 of them will be obese, at least. And so it's a real epidemic, as the CDC calls it. It's a real epidemic, and it's one that look at the people that are the worst performers, or the worst, the people that have the most risk with even this coronavirus. Who are they? They're the people that have chronic lung problems. They're people that are obese, people that have diabetes, people that have hypertension. And so if you look at those last two, hypertension and diabetes, their risk is obesity. So you have chronic lung problems, obesity. And so these problems, it affects every area of their lives. And so it's something we really, as Americans and physicians, really have to get after. We really have to modify how we do things and stop reacting to the disease process, but really start working on the other side, help that person better their health.
Yeah, I think there's such a dealing with sometimes a stigma that people feel if someone was to bring up the issue, especially a physician. I mean, I'm assuming most of the people that want to be coached by you have already, they're already in a place where they're motivated, or at least interested in that process, and are reaching out. But any comments on just stigma and approaching people about this?
What I do, sometimes people will come in and say, I'll say, let's look at your blood pressure is doing pretty good. I said, hey, at the end of the encounter, I'll say, everything is okay. Your blood pressure is doing okay, but I'm a little bit concerned about your weight. Mm-hmm. And many patients are concerned about their weight as well. But it's like the elephant in the room. Nobody wants to say anything about it, and they don't want to bring it up, because if you talk to them, many of them have tried so many different things, and so now they're just frustrated. They don't want to talk about it. If it's just going to be this way, it's just going to be this way, and they really need the hope to know that, hey, you haven't tried everything, and so I find that very gently, it's an easier topic than we think. And certainly I believe that as physicians, if somebody storms out of my office, at least as a physician, I have to tell them, hey, your weight is not good. We need to do something, and give them a structured way to do something to control it. As if, even if I were to say, hey, your blood pressure 180 over 120, okay, we need to do something. Well, the same thing, we have to approach that as a major health issue. Your weight is a major health issue, and we have to be able to address it.
Well, and I liked how you phrased that, though. Because a lot of these kind of bridging terms and the way that we frame a conversation is not something, again, that we were necessarily taught as physicians. And it can be quite challenging when it comes to obesity to talk about it. And typically people will say are you aware that you have a weight problem? Or do you want to lose weight? I mean, and they're almost accusatory in a lot of ways, and they can generate, and it's rather than sort of eliciting a smooth conversation or a caring conversation, they generate conflict instead. Yes. So with this term that you do, where you're like, kind of framed it up front, what's going well, and then you just kind of throw out there like a little seed, I'm a little concerned about your weight. And then with that pause, what you're doing is you're allowing them to respond, and it's coming from a place, you're verbalizing that you care, you're doing it in a non-confrontational manner, and you're letting them to respond how they want to respond, which it's just a short little phrase, but I think that's a beautiful phrase.
Yeah, absolutely. And people really respond. They're like, and I can't say everyone has said, yeah, I know. I know. I said, well, hey, let's do something. This is what we can do. And people are very, very endearing and embrace doing something about what their weight is. I've had people that I've talked to say, I don't feel good about myself. Not just now from a physical standpoint, but now we're talking emotionally. I don't feel good about myself. I don't like to take pictures. I don't want to be in front of anyone. It's almost a shame. They have a shame about how they look and the fact that they can't seem to do anything to get weight off, and so they retreat into this place where, well, I'm just going to be like I'm just going to be. And I think we as physicians have to always bring that hope. And hey, we're just going to work until we get it right. Like we do with any other disease process. And instead of adding necessarily 3-4 diabetic meds in terms of we're going to get this right or get your blood sugars down, we're going to go back to say, hey, I don't want to add another diabetic med to you, but I believe that if we can get your weight down 20 pounds or 30 pounds, you're not going to have to add any more medication. And I may be able to decrease some of the medications that you're on now. And just that hope, that sparkle of, man, I could maybe reduce my medical prescription bill. Hey, let's do it. And I think if we do it as in terms of if we're partnering with them to help them do this instead of you go do, then I think they really receive it a lot better and really are encouraged to do something about it.
Yeah, I'm curious, what is, if you feel free to share it, if you're comfortable with it, what's the actual coaching program that you did to get certified?
Well, the actual coaching program, it has different facets. It's different, so that depending upon what a person needs, it'll have, there's different programs within it to place them in. And so what we really do is we do a health assessment. It's just over the phone, free consultation, and just assess their health and see where they want to go, what their goals are for their health. And then depending upon what they want and the different facets of their medical problems, then we are able to put them into a program that is going to work for them.
But the training program that you actually received to become certified as a health coach?
Yes, it's part of that program. Yes, it's part of the program that we do.
Is it something you can share just for if someone wanted to become a health coach, or is it something that's best to keep under wraps?
Not so much in terms that it's everywhere. Okay, it's not a it's not.
I gotcha.
But what we find happens is that we really want to talk to that person or talk to that coach, and what we found happen. We used to say the name of the wellness program all the time, but what people will do is they'll go to the website. They'll order a bunch of food. They don't get the evaluation. Hey, you didn't need what you ordered. They do it all without getting a coach. That's one of the most important things, is getting their coach. We tailor their meal plans and nutrition for them, and they don't get involved in the community. I put things on Facebook, and there may be 50 people that'll get on and say, man, way to go. You lost 10 pounds. That's fantastic. And so they get that positive reinforcement every time. And then they oftentimes will not get the educational materials that they need, the Habits of Health book and the Life book. And so yes, yeah, I tend
Well
not.
said.
Yeah.
Well,
Yeah.
and that makes sense, because you're in a lot of situations is you're trying to frame that journey for them. Like, as a good mentor or guide, is to make sure that people are taking the right steps. And sometimes the best way to do that is just to make sure that you can help them choose that right step, rather than push them out the door. But I'm curious, from a physician's standpoint, we've talked about the power of coaching a little bit. We've talked about how you got involved in it. If there's a physician out here who's perhaps interested in health coaching,
oh man,
where what's a resource that you would recommend for them to start, as maybe just an introduction to say, hey, if you're interested in this, here's a place to go, you can learn more?
I would just give them my cell phone number.
There we go.
Honestly, I would just give them my cell phone number, because it's a ripple effect as more physicians get involved with this. It's a ripple effect. I may have 20 people. Well, with your 20 or your 50 or whatever, we can really begin to make an impact. And then those patients can begin to make an impact, because people will say, wow, what are you doing? And I say, well, my doc has me on a wellness program. And they'll say, well, I want to do it too. I need to lose 50 pounds. Mm-hmm. And so it becomes this grassroots kind of initiative. And friends are helping friends, and families helping family get healthy. And so, yeah, I'll give you my cell phone number. Just call me, and I'll tell you about the program. Even people that want to be involved with it, from a standpoint of being a patient or being a client, is absolutely just call, and more than happy to get people started.
Okay. Maybe we'll add at least maybe an email to the show notes. And if they want the phone number, they can ask for it.
That sounds good.
Sounds good. And do most people they find you on your Facebook page? Do you lead them to that, or is?
Yeah, Alinda Cox, you can message me. You can find me on my Facebook page. They can just put a little note in there. Hey, I'm interested in your wellness program. I'll get right back to them, and then we'll go through it and systematically make sure, if it's a coach, tell them how it's done, make sure that they're successful, and do training in that way. And then if it's a client, hey, I want to lose 100 pounds. Okay, let's put you in this program, and help them lose, and they have the support and the resources to do that, because the most important thing is changing the mindset. Changing the mindset is the most important.
Yeah.
So Alinda, I want to be very appreciative of your time. I don't want to take too much of it, but what I would be kind of curious is, Alinda today, and you're talking to Alinda of years ago, knowing what I know now, what would I tell myself? Because there's going to be a lot of physicians that are probably at that place where they're recognizing that, we go into practice, we want to help people get better. And then we start getting into this this hamster wheel of prescriptions and reactive care model.
Yes.
So if you were, again, looking at your old self as Alinda, yes, what piece of advice would you want to tell her that may be supercharged or start this process off and a little bit quicker, faster, or better, or anything else?
Yes, I would tell Alinda of old that don't be afraid to get involved with a person's life. Because the Linda of old was just, hey, okay, let's do this, so this, so this. And in the back of my mind, I'm thinking, okay, she needs to lose 100 pounds. That's what's causing all this problem. But not be the person that says, hey, how are you doing? I'm a little bit concerned about your weight. Is there some way we can help with this? And so becoming more involved. Don't be afraid of becoming involved in a person's life, in their lifestyle. It doesn't commit you to going to their birthday parties, or you know what I mean. You're not, you don't become their best friend, their BFF, but people love that you are concerned about me more than just my blood pressure and it's time for my annual exam and I'm out of here. Mm-hmm. And because I think people, if you don't address it, I think people can kind of think, they didn't say anything about how much overweight I was. Mm-hmm. And so I think Alinda Voll would have been, I won't say the term aggressive, but I would say the term more inquisitive about their health and being more compassionate in terms of asking them, how can we fix this? What can we do? I know that there's something that we can do here, and let's get involved with that and get you where you're not having this problem.
Yeah.
And one thing I mentioned, and I forgot to mention in terms of all the different, I mentioned about the different cancers and things like that, but also infertility. Mm. Infertility in young women is a big problem, and a growing problem, and many problems are because of their overweightness, and that just messes up their whole endocrine cycle. So doing that is so important. So important.
Before Kevin closes us out, I just want to ask or make a comment that I think maybe a lot of physicians don't realize, and you can attest to this, but coaching versus being someone's physician, you can do across state lines because it's not medical. Is that how you're?
That's right. That's right. You are helping your patient or your family or whoever create health for themselves, and so you're not prescribing any medications. There's no third-party payer. You're helping people with great training. You're helping them with a community that helps them and supports them. There are different foods that you help them, or feelings that you help them know and enjoy. They get educational training, and so yes, it doesn't involve your license or going over state lines or anything like that.
Awesome.
And the company really loves that people are trying to help people, and so they do help in that way. So many physicians are not compensated for doing anything in terms of helping their patients lose weight, and many insurance companies now don't even list that. I mean, you can't authorize somebody because they have a BMI of 40 to have any kind of supplementation. And so that's one thing that we've also kind of conquered, the wellness program.
So resources basically is what you're saying for physicians that are outside of traditional healthcare practices, because traditional reinsurance won't reimburse for them. So in this, you're going back to a more of a direct physician-patient interaction again without the third party. So you can now, or in the company that you're working with, provide resources,
yes,
which we don't see.
Yes.
Which is both great and very sad that won't invest in this stuff.
I know. It's incredible. CDC absolutely says it's an epidemic, and we can't get insurance coverage to help.
Unbelievable.
Yeah.
Well, thank you so much, Dr. Cox, for joining us today. Really enjoyed your hearing your change physician journey in involving coaching and how you kind of developed and revitalized your practice with that. Again, for everybody else out there, if you're interested in helping people get better, coaching is a great way to do it. I think as physicians, we sometimes think that it is something as a skill set that we can't have, but it's definitely learnable.
Yes.
And I loved how you were basically saying it's something that we should be able to do quite easily, or not. Right. I shouldn't say easily, but it's something that we as physicians have the capabilities to do.
Yes, absolutely.
All right. Well, thank you all, everybody out there. Thanks for joining us today on the Changed Physician podcast. Remember to find all our resources as well as links at thechangedphysician.com. And until next time, stay well.
All right. Thank you.